Okay, sorry, I didn't know. Yeah. Also, you remind me if I don't start the recordings, okay, admins. Today I started, the other day I forgot my session. Okay. Yes. Just join and let's wait for 2 minutes, Anju, with smile. Okay. Be cool. Speak as if you are discussing with your friends, that's all. Very cool, very simple, very slow. Yes. Tanshim Yusuf Shad. Hello, yes, hello, hi. Tanshim, yes. Somebody from UK. Menu from the school platform is free. Tanshim is Edu 233, yes. Let's wait for 2 minutes. Yeah, you can. Mini will be sharing, right? Or you are sharing screen? Mini, are you sharing the screen? Huh?
Yes, Acha.
Yeah, I can hear you. Or yes. Okay. After introduction, you can start sharing.
Okay.
Anju,
Yes, Father.
look, best wishes.
Thank you, Father.
Yeah. Good smile.
Can I start, Father?
Yes, you can start.
Okay. Thank you, Father. Thank you all. And before starting the class, can we do 1 minute for prayer? Good evening, Father. Good evening, all admins and all Edu skill aspirants. My name is Anju. I'm one of the Edu skill aspirants. So thank you, Father, give me opportunity in front of you. So today we are going to discuss writing. Just introduction, what is writing and all criteria today I'm going to discuss. So Miri, can you show the slide?
Yes, this screen is visible or not?
Yes, it's visible. So today topic is OET writing. So we just discuss basic introduction. Everybody's know about that. It's like firstly in exam, firstly it's listening, reading, and then writing. It's a third module when we sit on exam. So it's a duration of writing. It's 45 minutes. And before start the exam, so the examiner gave me a 5 minute just for a reading time. And that time we don't use pen or pencil. We just read it. That time we can't touch a pencil. And just left over for 40 minutes. That 40 minutes we need to complete our task. So it's total 45 minutes. 5 minutes we just a reading time, and for 40 minutes it's a writing time. Next slide, Mimi. In writing, three type of letter: refer letter, transfer letter, and discharge letter. Writing subtest. I already discussed, like before start the exam, they give only a 5 minute, and that 5 minute, how we can utilize, because it's a main too crucial. So flip the page for the writing task. Firstly, when if somebody like go through the like for exam pattern, so directly we just go to the task. It's a writing task, like in a based on that it's a too crucial for a writing. So who are writing to and what is their job title, like when we are writing to the someone, so who's that person? Firstly, we need to focus on that. It's the last portion of the case note. And what is your role in patient care? In a starting of the exam pattern of OET, they already mentioned that we are a nurse, we are a clinical nurse, we are an emergency department nurse. They mentioned that who we are in the beginning of the case notes. And it's the purpose of the letter. It's a discharge plan above the writing. So it's a step by step. They already mentioned the whole detail of the patient. And based on that, we just need to evaluate what is the relevant case note, what is the semi-relevant, and what is irrelevant. When we start for writing module, so everything is clear that time. So now I'm just like overall, I'm going to discuss. Next slide, Minnie. So it's a writing time, 35 minutes, remaining 5 minutes for proofreading. So total 45 minutes. 5 minutes we already used before start the reading subtest. And when we are competent, so we need to try within a 35 minutes, we need to complete our task. And remaining 5 minutes, we just the proofreading. Like where sometime we just change the gender. Like and it's a case note, they mentioned that the patient is she, but we are just too hurry when we are doing writing. So when we do he, and when instead of he and she, we just replace. So it's a like our marks suddenly deduct. So that time 5 minutes we need to more focus, like any spelling mistake and any comma, extra comma, sometimes we just to hurry that time. So just a 5 minute, in the remaining time we need to more focus and use a dark pencil. Avoid multiple erasing, because sometimes we are just mentioning and again erasing. So we need to just avoid and align with the both side of the page, because there are two pages in mention that, because according to the our words, they already like give a full pages, so easily we can write our task. Punctuation, accuracy, spelling mistake, we need to check within a 5 minutes, last 5 minutes left. And do not use any judgmental words, because it's a not mention, it's a simple way we need to write our writing. And leave space after each paragraph, like don't mash all writing tasks, because firstly when we do the purpose, and then like in a space, one line left, again like in next paragraph, again when we are completing a writing task writing. So if we want like in a task are too lengthy, so 3 and 4 paragraph we can make it, but every paragraph we use this space. And medical term can be avoided, and splitting words can be avoided. And never assume in writing, like firstly go through the step by step. Don't like today we are doing just the writing intro, and we are just thinking about that, okay, it's too simple and we can do it, directly go to the writing task and do it, and we don't know how we can do step by step. Firstly try to understand, and then after we need to focus on. Is that correct? So many can next slide please. Okay, step 1 to 8, and we need to use in a writing, and 22 step already used. Next slide I will tell, but firstly I will explain what we need to do when we are doing a writing, step 1 to 8. So step 1 to 4, selection the case note, organize of the para, identify the main issue, underline the keywords, segregate the case notes with keywords, and transform the case into sentences, construct the different type of sentence. These 1 to 4 step means when we got 5 minutes before starting the writing, that time, because when we are doing the writing and we are fully competent, so easily we can select the case note, and easily, like if we in a mind we already organize the whole paragraph, like in a which paragraph and what information we need to mention is there, and identify the main issue. It too crucial. Based of the main issue, we can easily like write our purpose in a good way, and underline the keywords, which information is relevant and which information is not relevant, and segregate the case notes with the keywords and transfer the case into the sentence. And then based on this information, we can easily construct the different type of sentences. Because for example, in a second paragraph, we know very well we need to mention is a medical history of the patient. So easily we can evaluate as a past medical history and present medical history. So we can like construct the paragraph, make one paragraph in a good way. So that type of, when we are competent, so easily we can mention, okay, this information we need to mention fourth paragraph, these information mentioned in the second and third. And step 5, intro paragraph purpose. Step 6, it's a body paragraph. Firstly, like when we are doing a purpose, so it's a body paragraph 1, according to the father's strategy. And father already explained or already coded video already on YouTube. So father mentioned that like in a purpose, so it's a after purpose, the first paragraph, it's related to present condition. Like what if we are saying that it's a discharge letter, for example, patient is suffering from something, it's condition. So in the next paragraph, we mentioned that, okay, what is happened? And then it's a other paragraph, second paragraph, we can mention that patient, the medical history, and all related to like the past medical history we can mention. And it's next paragraph, we mentioned that during the hospitalization, according to the case notes. And in the last paragraph, we mentioned that, okay, what we want to, when we are writing to letter to the doctor, to the nurse, sometimes relevant known case or unknown case. So based on the patient requirement, in the last paragraph, we mentioned that. It's a present form. And step 8, self-correction criteria. We need to evaluate like where we are lacking or not, because it's too crucial. Because if we are not self-correction to ourselves, so we can't improve, because we are thinking that, okay, we don't need to check our writing subtests. So we need to follow 1 to 8 step. If we are follow 1 to 8 steps, so definitely we are competent and we can easily get our desired score. Next slide, Mini. Okay. What is the format of writing subtest? So firstly, it's a date mention, and date, when we go to exam pattern in OET, so already they mentioned that the date, it's a today date. So we can use the directly date in here. And but apart from that, for example, the date is not mentioned. So what we will do? Directly we can use when patient admit in a hospital. So that time date we can use here. No need to like confuse like, okay, it's a date is not mentioned. So what we need to do? We can use, but in exam, definitely they already gave a date. So that date we can use, and address for like when we are writing to the letter. for someone like in a doctor GP, that address we need to mention is here. Regarding, dear, purpose first, purpose expand, other paragraph, and request. It's not only like we can't say that like that. Okay, only just 3 paragraph we just need to mention. No, it's based on the patient information and writing task. So we can make 3 and 4 paragraph, but we need to make the paragraph in cohesive manner. And then is a sign off. Sign off is faithfully, and so based on it's a sign off, like we just need to then after we need to mention our name. And the body of the letter, it's 180 to 200 words. So our total words is 180 to 200. We can't like less the words, like less than 180, and not more than like 205, 210, it's okay, but not more than. But if we are easily like in a good way, we are like select our data. So we are not like our words are not more than 180 to 200. If we are going to select in a relevant data, relevant and semi-relevant. Irrelevant data, like when you are competent, so easily you can directly when you see that subtest, and easily you can like cancel that. Okay, it's irrelevant. No need to mention is okay. When we do practice in OET, so that time we will discuss. Next slide, Minu. Okay. ISBAR. This is the main thing we need to focus in our writing, and Father already explained in a good way. So focus on the health issue, not on a health professional. Structure, clarity on how to plan and organize your letter. So we can say that it's a backbone to our writing. If we can understand the ISBAR, so everybody we are like it doesn't mention like it doesn't mean like we are competent too much in English. Sometimes it doesn't matter if we are following the ISBAR and are grammatically, and I'm saying that our English is, it's not required too much good. Like if we follow and we know that okay how to organize the letter, and we follow the ISBAR, so easily we get a desired score. So help with inclusive and inclusive criteria based on ISBAR. Health industry standard approach matches with OET. It's a writing assessment criteria. And if we are following the ISBAR, definitely we get a job in NHS in anywhere. So definitely that time we need to use the ISBAR benefits. So we need to focus. Purpose, content, concise and clarity, organization, genre, style, and language. These 6 things our OET marks are based on. If we go to purpose, in a 2 out of 3, content 5 out of 7, in concise and clarity 5 out of 7. Like every like a genre and style and language we go to 5 and 7. Then we go to grade B 350 to 400. Purpose 2, all other criteria 5. So purpose is it's a backbone, we can say that, because if we go to purpose in a 1 out of 3, so we didn't get a like in a B score. Next slide, Minu. ISBAR, introduce, identity, situation, background, assessment, and request. Everybody like all doctor and nurse, and everybody know about that when the patient came. So firstly, what we ask, the introduce, identity we are going to check of the patient, and then of the situation, which situation is came in a hospital. And okay, if the patient said okay which situation, then it's a background. Background includes it's a medical history, past medical history, because sometime patient came in hospital and some it's a respiratory situation, and so definitely we are asking to the patient the background. maybe it's suffering from asthma, COPD. So that's why background is too crucial. And then assessment. Assessment is included subjective and objective criteria. Patient is saying something, and what we are assessing to the patient. It's assessment. And then request. So we are we are going to request for the GP, we are request to the nurse in charge, and based on a letter, like it's a discharge letter, it's a transfer letter, it's a referral letter. So based on the letter, we are using ISBAR. So identity and introduce. Patient details, name, age, address. Situation, medical history, family medical history, and lifestyle. Because patient is drink, patient is smoke. So all these things we need to evaluate that time. So because based on that, we can make a diagnosis. Background, hospital treatment record, patient suffering from any condition or not. So it's hospital treatment record means admission, assessment, management, evaluation, and discharge. Assessment, observation and assessment. Observation, it includes emotional fitness, medication adherence, means he's taking something medication. If suffering from like any disease and taking medication, so it's too crucial, because without thinking we are giving some medication and it's a react. So who is responsible? So we are. So each and everything we need to focus and check the vital sign. And in environment, it's family sports, patients stay with the family or patients stay alone. And request, it's a plan, it's a last paragraph of the writing. Now what should be done? What action, we need to, we are writing to the letter, so what we want he need to do. So it's a transfer and refer letter, medication, patient history, test and result, and observation. That paragraph and that we just mentioned that, okay, patient is recovering well or not, is about the patient condition and patient appointments and patient anything we need to mention in a patient request, last paragraph. Next segment. Same I already explained, ISBAR. Who are the patient? Who is the patient? Name is. Why are you writing? You need to ask to question yourself. Easily we understand the writing. Situation. What is happening now? What, when, how? 3 questions we need to ask. Admission date, diagnose, observation, and most recent sign, which isn't vital sign. It's a situation. Recently, what is happening? So we need to evaluate to the patient. Background, it's a patient to letter to the situation, relevant past medical history, any allergy, any relevant social information we need to ask to the patient. Assessment, based on the symptoms, investigations, and relevant role. We just assess and request what you want to the next health professional to do, what we want, what care the patient needs. So we need to focus on that. I hope so everybody clear ISBAR. And thing to remember while writing a letter. These things we need to more focus when we are doing the writing. Sentence correction. We are not doing a mashup to it's a simple form, simple sentence form, and we are just mentioned that okay in a past. So it's not a sentence correction. It's not a cohesiveness in a letter. So it's too crucial. Sentence concentration. Case note expansion. So definitely when we are start the writing, we can't stuck just from the introduction to the patient and just purpose. So what we need to do, if we are competent, so that time we can easily expand the case note. So it's too crucial. use of a proper grammar. We know very well, okay, where we need to active voice, where we need to passive voice in a grammar. And passive sentence are preferred because sometimes we want to the patient, we are saying that. So that time we are using a passive sentence. If patient is saying, so that time we need to use active sentence. So no need to worry when we start writing. So step by step, everything is clear. But we need to focus on a mind, like it's thing to remember, okay, which thing it's included in writing. Use of a complex sentence. What is a complex sentence? Avoiding judgmental sentence. Means it doesn't matter like we are just we don't know what is the its sentence formation. If we know the complex sentence and compound sentence, so we can write in a good way. Avoid using a short form. It's not accepted in OET letter. We can't use it as short form. Use abbreviation clearly. In a writing task, they if they mention its abbreviation already, that time we can use abbreviation. Otherwise, we need to avoid. Avoid informal connectors. So, moreover, furthermore, besides, meanwhile, and so we need to avoid. We can't use its informal connector because in a writing we need to, in a formal connectors we need to use. It's a proper way. We need to cohesiveness or letter. Do not copy from the case note because in some time we can't construct in a case notes and a sentence formation. So we just, what we need to do, we just pick the line and just copy. No, you need to try to convert to your own language. It's a little bit like we can use, but don't like in a just pick the information and just copy on a case note. We just need to avoid. Little bit is all right, but not all we can copy. Next slide. So OET writing step by step. First step is identify the key issue. Highlight the keywords, synonyms, and reference in the case notes. Means, for example, right now our writing module is going on. So the father already saying that right now we are not need to jump on like do the all writing. Firstly, we need to improve our skill. So what we are doing right now is skimming and scanning, because if we are competent, so easily we can complete our task for 10 minutes as per the father's strategy. So same in writing. Firstly, don't need to jump like bring the case note and try to start the writing. No. Identify the key issue. Try to understand. Use your 5 minutes. Because put the timer and try to understand, okay, my 5 minutes, it's utilized or not. I can pick relevant, irrelevant, semi-irrelevant data. Because if you are not picked, so it doesn't matter, like you are going to step by step. So second is identify the relevant, semi-relevant, and irrelevant case note. Third, transform each case note into a simple sentence. Means when you pick the writing task, the whole case note, just try to transfer in a simple form. Subject, verb, object. Simple. Try to understand. Because when you are competent, when you are used to the writing, so then you can easily cohesiveness. And then after to differentiate, okay, which information I need to mention, which paragraph. Check with Grammarly. Because if you are writing simple sentence, you think that, okay, it's a simple sentence. I did write this information. It's good. It's a Grammarly fit or not. Then transfer simple into compound. Firstly, clear your step. Okay, I make a simple sentence. Then try to simple sentence into compound. Check with Grammarly. Okay, I'm competent to sentence simple to compound. Then simple sentence, compound sentence into complex sentence. How you can make, which information I can organize together and make a complex sentence. Again, check with Grammarly free. Next slide, Mini. And then write a story of the patient. Okay, patient is coming, a patient is suffering from that, patient is happening like that, it's a past medical history, I will give something, I to transfer. Try to understand, try to the same like it's a paragraph. No need to, firstly, when you are going to start writing, no need to mention that, okay, it's in a letter form. If you are competent, you can, but in a beginners, firstly, just try to write a story. And you know very well, because when you write a story of the patient, so you know very well what is the cohesiveness in a letter. You can't, like in the starting of the introduction, you can't, okay, this patient and this request. It's a request formation after medical and non-medical history. And then in a third paragraph, if you mention that current situation. So what, it's an auto-cohesiveness. But you mentioned that, okay, patient is coming, this is the patient situation, and it's a past medical history when you are writing in a simple sentence. So you easily can understand, okay, this is a cohesiveness of a letter. And step 11, segregate the case note sentence based on a key issue. So when it's a 10th step is complete, so that time you're competent, easily you can segregate the case notes and make a different paragraph. 12, arrange the sentence point according to the sequence. Same above, I already explained that it's a cohesiveness. So where we mention the purpose, where it's a second paragraph, you need to the current situation. Third, it's a medical and past medical past medical history. And final paragraph, it's a plan. So write the different paragraph. A is chronologically, B is thematical, issue based. Chronologically means some relevant case note. It's mentioned that according to the date, okay, patient is admitted, this date is happening. So it's a chronologically. Patient admit is this date, and when this date we need to do most of the case note mentioning the date. So it's chronologically we need to mention that. We can't say that, okay, today is 6 July. Yeah. So 6 July, it's a firstly we mention 6. No. Yeah. 6 and then we 5, we 2. First, in a cohesiveness, we need to use in a chronologically. Okay, then, according to date. It's a chronologically we need to mention that. And thematically issue based according to the patient issue. And what is the important? It's crucial when it's a crucial issue. We already use in a purpose when we make a purpose for the patient. So that time we use thematic and issue based. So we need to more focus which issue we need give a priority. And introductory phrases, connective words, and sequential words we need to use when we are writing the different paragraph. So we will discuss these type of thing when we start writing. And 14 step, start writing the Latin writing format, address, date, salutation, regarding lines, introductory, means it's a purpose paragraph, why you are writing. It's a body paragraph based on the purpose. Second paragraph is body paragraph, request and recommendation. Okay, everything is mentioned in the letter, but what request do you want in front of people when you're writing to the letter to the someone? So what is the main thing? Why you are requesting? Because patient need to something. It's too crucial. So it's a recommended paragraph. We can say it's a sign of is sincerely and faithfully. And sincerely, when we may use that, if we are knowing to the patient, no, it's a name is mentioned that we are writing to the someone, doctor, for example. So that time we can use sincerely. If the name is not mentioned, only just mentioned that is a physician, it's a GP, not a full name mentioned. So that time we can use faithfully. Because sometimes when we are writing, so we are just confused. So it's a main part in the writing. So sign off. We know very well when we need to use sincerely and when we need to use faithfully. And point 15, mistake to be avoided in writing, in OET writing. And next slide, Minu. So this is introduce and identification. This is a letter format. And this is a cohesiveness, like we know, sometimes we forget, okay, because I already explained, but if somebody is beginner, so they don't know, okay, what is the purpose, what is the content, where we need to focus that concise and clarity and genre and style and language. So in here, letter of the admission to, it's a model letter, 30 August 2019. It's a date. Okay, it's a writing format. And it's emergency department consultation. This is when this information not to the patient. When we are going to writing to the someone, that person in that departments, this information they mentioned that all. And dear doctor, because we are writing to the someone, it's regarding means it's a format. We need to mention the patient name and date of birth. Okay, sometime date of birth mentioned in the writing task in this way, and sometimes they are mentioned that okay, it's a 70 years old and 60. So it's a different format, and it's a purpose. I'm writing to refer Mr. Style, 60-year-old widow who require urgent admission and investigation due to suspected reoccurrence of pericarditis. So this is a purpose. And second paragraph, third paragraph, and last fourth is a request. It's a recommendation. So this is just, it's a model letter. What is the purpose? Purpose of letter is immediately apparent. Expand the body of the letter. It's the same. It's a main backbone to the writing. So if our purpose is correct, so based on a purpose, we can easily expand our letter. What is the content? Content is appropriate to intended reader. Key detail includes not important information is missing. Means what is the relevant information? So definitely we need to add in a writing. And irrelevant data we can easily eliminate. What is relevant, irrelevant? It's depend on the case notes of the patient. Means if patient is back to the care home, so already patient staff means it's a care home staff. They already know the patient. So what? It's a known case. We doesn't need to mention that patient past medical history, relevant personal history, because they already know. So what we need to do? We select that case note. We just select the, okay, patient came in a hospital. That time, what is happening to the patient? And what we need to, more thing we need to do. Okay, so for example, we need to do this medication, some medication change and some position to the patient, and some like in a book appointment to the patient. So that time, that details, it's too crucial. So this is a known case and an unknown case, and we can easily select the information to the patient. Concise and clarity. Length is appropriate 182 to 200. Effective summarize, organization and layout, logical flow of information. In this model letter, they like firstly they mention that purpose, what happened. Okay, they say that on a home visit, he's complaining chest pain and refer to the seating position as well as shortness of breath and fatigue. She had a low grade fever. Each and everything they mention that. So it's a flow. Then appropriate paragraphing, subsection well organized. Third paragraph, okay, what she reported. She said, okay, she's unwell, what is happening to her, and what, like, what test it's done, like in X-ray at that time was normal. So Mr. Style was treated with IV saline. So what action is taking here? So it's a cohesion, it's step by step. They like, it's a clarity. They mention that in a paragraph. And fourth paragraph, Mr. Style medical history, which managed with metformin. All medications are mentioned. She also suffering from depression. So what is relevant? It's important, like which information we want to give. We are writing to the letter to the someone. Which information is crucial? So that paragraph here mentioned that. So this is a concise and clarity. It's a logical flow of the information and appropriate of the paragraph. And suspected, it's a well organized. Generic and style, clinical and factual, appropriate use of abbreviation. Because if we are going to use abbreviation in OET letter, so we need to use in an appropriate way. Like if, for example, in a writing letter, for exam pattern, they mention that PCM. They can use, any abbreviation they can use. So we can't use PCM. We know it's a paracetamol. Right? There's a blood pressure, BP. So sometimes we can use abbreviation, but sometimes we not. Language is accurate, not inference with meaning. Same, we need to mention its cohesiveness, and it's a good language we need to use, and it's a formal language. Means we can't use informal language in OET letter. Hope so it's clear. Any slide left, Minnie? It's done. Okay. So hope so it's clear. If anybody have a doubt, so ask me. It's easy if you are follow the strategy. Father already explained. If we are using in a letter, in a OET, if we are using like ISBAR, so easily we can crack our writing, and everything like all father video, it's already recorded in step by step in a YouTube.
Yes. Vinny, you can stop sharing as soon as the explanation is over, okay? Every day. Congratulations, Anju. Done well. Yeah, great work, great work. Let everybody do this initiative. And that gives clear clarity. Not only that, some force is required for us, right? Can you see me? Yes. Some force is required. So when you have to present, teach, there is a force that you have to clarify yourself, discuss well, understand well, prepare well. That will not happen without that force. That involvement of your brain will not happen. And also, always I have suggested, if I watch my videos on writing, do follow ISBAR method, because that is the only internationally accepted method which you will use any of the countries if you go abroad. You'll have to write the letters as a nurse, registered nurse, you'll have to write letters in that same format. If you don't learn now, you'll have to learn asking somebody from there. So you'll be learning again letter writing once you're employed abroad. Okay? Because people thank me specifically for this purpose, for teaching ISBAR. It becomes very easy for them when they reach there. When others are struggling, these people coolly write down the letter. Yeah, if you want to ask her anything, you can ask. And beginners, don't worry. This is also an exposure for you. because our platform has people from different categories. Those who need some writing, we are refreshing the writing ideas. Beginners can also have some ideas. When you have extra time, you can keep in mind. So when I teach you again in the batch, you will understand better. Any questions? Yeah, do you all click the like button? Jesse, Gigi, we are late today. Come in time, okay? Usually we don't admit after 4:25. That disturbs the streaming. Cool. Anything else? Right. Anything else you want to ask me or clarify? At YouTube also you can type in, or if you want to join Zoom, you can join now for the discussion, no issues. Or you can just type in your concerns in the YouTube comment space. Admins will read it out for me. Keep smiling. Yes. Congratulations, Tomali has done a good job. She has sent me a short video of 2 minutes. Nicely done. Good. So do it somewhere. That helps you to build confidence. Record something maybe in any of the languages. I said any of the 7 languages. It doesn't mean you should do only in English. But try even in English. Beginners can do in any language just to get clarity about the strategies. What you call tips. No? Usually nurses call tips, it seems. Actually, it is not tips, it's strategies. Tips and tricks. Yes, not trick, not tip, but strategy, yes. How many paragraphs must be there? Who wants to answer? Anybody wants to answer? How many paragraphs in a letter? There's a question in the YouTube comment space. Yeah? Only Prabhakar is speaking, but you are muted. Anybody can answer. Somebody is asking in YouTube comment space, how many paragraphs are required for a OET writing
3
letter?
paragraphs.
Minimum 3, Father.
Minimum 3.
Minimum 3. Okay. Which are those paragraphs?
Purpose paragraph.
5 3. 3 4 paragraph. Total 4. Introduction.
Okay.
Except purpose paragraph, we have to write 3 paragraphs.
Okay. Yeah, it all depends on the material and occasion, but then usually you need a purpose paragraph, which can be 1 sentence or 2 sentences or 3 sentences. 1 sentence could be the best purpose paragraph, 2 better, okay, 3 good. Not more than 3 sentences, but 4 things to be covered. I have clearly explained in my videos with visualization. We need a ultra deluxe bus journey, 4 wheels. Okay, I've asked you to answer 4 questions. You can ask yourself, write your purpose paragraph, ask yourself those 4 questions. Do you have answer in that? Or else if you miss one answer, one aspect, it will be auto rickshaw journey instead of deluxe bus journey, no? Ultra deluxe, Airavata. And sometimes I also give an example for each one of them. And 2 aspects missing, the body paragraph will be cycle journey. And maybe some connective word mistake can become, I have shown you a man carrying the cycle on his shoulders. Because yes, Mr. X, who is suffering from some condition, is in need of, which is admitted in the hospital, which is in need of immediate assessment and attention for this XYZ. So which refers to the hospital. So it means hospital needs immediate assessment and treatment, not the patient. So I have told you exactly, I have given the syntax, word order, tip by tip. In 21 steps, I have explained every step, every bit of every line in your letter. So follow that. And as already Anju said, unless you get at least 2 out of 3 in your purpose paragraph, whatever you do with other paragraphs, you will not get B score. That's why I have given such clarity about purpose paragraph. You can definitely get 3 out of 3, then you are very safe. Because it's one sentence, 4 aspects in one sentence. If you do it in one sentence, you show that you are competent, you can write well. Yeah. Then, so then you have purpose expanded. Next paragraph is known as purpose expanded. Then body paragraph. Then you have conclusion, minimum. Purpose has to be written. Immediate paragraph, you will be expansion of this purpose. This will be explained well. Purpose will be explained well. Then next paragraph, whatever the medication are the details given. Then say hi, bye, nice, and go. Yes. There are so many people who get 400, 350 above in writing. These days I have found so many results. They need only 300. They go good in writing. It's a simple one letter. As compared to other exams like IELTS, TOEFL and all, they have like one report writing, another essay, long essay, 250 words in the writing subtest. Here you have just one letter. Yes, anything else? Hope we have answered that question. Really nice, excellent, great job. Anju, yes, to Anju. Any other concerns? You can type in at the YouTube comment space. We will answer you. These are the rare questions you get. Since my admins are very strict, I am supposed to sit every day here. Otherwise, you'll not be here. Okay. And if somebody is free, we need some volunteers to carry on with the batch. A lot of work is there. We are starting our real practice from part A tomorrow onwards, day after tomorrow. Tomorrow we'll be posting. Nitya, do you know first topic? Nitya, Mini, you'll have to just check and forward me the details as I said.
Okay, sir.
Yeah, first topic, I think, if you don't know, I can send it to maybe Shanmuga might have forwarded. Last time's discussion details. And Himani, have you decided what type of discussion will be there at 8 o'clock? 8 or 8:30? What is the time? Have you decided on it?
We are thinking about 6 o'clock, Father.
6 o'clock. Okay.
And I think first material is gonna be the fracture one.
Fracture, brother. Means fracture.
6 o'clock.
Yeah, it's
6 o'clock
already.
yeah, 6 o'clock is okay, right? Normally it was either 5:30 or 8:30.
Before we were doing 5 o'clock. No, meaning
5 o'clock,
our batch
maybe.
5 o'clock, yeah.
Yeah.
And then we decided 8:30, but
Yeah.
it's not convenient for everybody.
No time will be convenient for everybody, okay? So when you shift, we make sure that it's okay. Maybe you can also ask them to express their opinions. Because 5 was very inconvenient. That's why we shifted to 8:30. So 6 also might be inconvenient, I feel. I don't know. You can check out, maybe you can put a notice in the group and ask their opinions. For me, it is cool. Mini will be available, right?
Yes, sir.
So 6 o'clock, I have my prayer. Maybe I can join after 6:35, something like that, if possible. Maybe it's on Telegram, no issue. Did you decide on the mode of discussion?
Yeah, 3 days Zoom. That's what we are gonna start with.
Okay. Sorry, it's fractures, right? Let me check. Takes time. Yes.
Shanmuga's sister have sent that notice in the task,
Where?
that group, task
Okay.
group,
What is the name of that group?
task, new batch 2025.
Task. Fractures, right?
Yeah,
Sorry, that is not the group. Task, new batch.
tasks, and then new batch 2025.
Yes. Is it in the beginning? They have sent so many, right? Oh,
I just send the message, hello, if you can see, Father.
okay. Yeah, I saw this, but I find so many postings.
No, it's
Task of
second
the
last.
day.
I sent
Okay.
that daily discussion one, the notice
okay.
and the
Fall in love with OET day 7S. That has to be made day 1 now. Right? You made my day 7 video into day 1. Far advanced. Cool. So Mini and Nitya, that fractures, if that discussion material is with you, or if you can contact Arya, you could forward me. Did I create a group? No, right?
All group.
Hmm?
Last time we created one group.
Not that one. I want this one in that order, no? One by one, as per the task.
Okay,
Okay.
Father.
I will get the task group.
Father, today I will ask us Arimam, then I will tell you that.
Don't you have, or first you check with Nitya also whether she has?
Arimam
Okay.
have some of the materials, then we will collect it from.
Okay. Okay.
even in the task batch, Father, it's just you, me, and the Shanmuga ma'am is there. So
Pardon?
we can add the Mini and the Manju sister and all.
Which one?
This task group, task new batch
No,
2025.
that one that will be confusing because
Okay.
when they are sending, this is all a lot of things of the previous discussion, the material, PPT, Zoom recording, all those things. That's
Okay.
not required there. Only after editing, we require to post there in our group, task group, no? So that you can, Shanmug, or you can post it for the people. This is not edited. It's all jumbled up. We are trying to put it in order. Did you understand?
Yeah, Father.
What? You just inform Mini or somebody when there is a task posted by Shanmuga, what it is. Okay.
Okay, sure.
Or yeah, otherwise there will be a lot of confusion there. Now what should be the name? Edu discussion task, right? Discussion resources. Okay. Maybe I will add Himani also here so that you can send the task here. Oh no, better you can send it to them personally so there is no confusion here. Add admin. Done. Did you see the group? Mini and
Yes,
Edu
Father.
discussion resources.
Father, there is the same name in the group. Before we created one group, discussion resource Edu Skill.
That's okay. Now this is Edu discussion resources.
Okay.
Or I will make it edit Edu. Okay.
Okay.
Edit Edu resources.
Oh.
Yeah. Factors, if you can identify today and send me only factors. Whatever is there, audio or PPT or just highlighted text or video or this, whatever.
Okay.
Okay,
Yeah,
Father, I will do.
right. I think the same track is being followed, or you can just consult with Helen and Shanmuga if they can connect. The previous session, same task can be followed.
Okay, Father.
Previous batch was given task, right? Day 1, day 2, day 3.
Yes.
Okay, Father.
Same can be forwarded to, you can inform Helen to forward it to Shanmuga, ma'am.
Okay.
Okay. Yeah, any other clarification? Nothing? All are happy? Kasturi will be doing a wonderful Tamil session, right? You can do by yourself, or I can put on the Zoom only for you, or you can just in the Zoom, you can see the PPT and I can send you the PPT if you want of any topics that I have taken. Same thing, you can see the PPT and explain in Tamil. Anyone else want to do it in Hindi or in any other language, you can do it. Malayalam. Okay.
In the Tamil YouTube channel exit, Father?
Yeah. Tamil, there is a YouTube channel. YouTube channel is there. Telegram group is there. Are you there in a Tamil group?
No, Father.
Tamil group admin? Just add Kasturi, who is in Tamil group admins.
I'm there for that.
Yeah, just add Kasturi. Okay. Let there be some fragrance.
Okay.
Yeah. Yeah. Yes. You can invite those people and put it in a Zoom, or you can just record offhand in the phone. It can be just spontaneous, need not be very professional. Because your own companions, colleagues, nurses, they need to understand, their language. And don't be very serious. Be cool, happy, as if you are talking to your friends.
Okay.
Hi, come on, dear friends. Come on here.
Kasturi,
So
can you
just
hi?
Yes, ma'am.
hi to Minnie Jackson. Nobody is sending her hi nobody is sending her hi these days. So she is requesting you to send a hi.
I want to argue Tamil.
Yes.
Okay, Mama. I will send, ma'am.
Yes.
Okay.
She will see your biodata and details and profile, then she will send. Yes. And if they are Tamilians, you can send a hi to Minnie Jackson. Okay. If you want to join. Yeah, that means also there are different groups. Tamil, Telugu, Gujarati, Hindi, Malayalam, Konkani, Kannada, English. Zina is Konkani, right? Bayama, right?
I'm Konkani, sir.
Yeah. So Bayama can do something in Konkani.
Yes, Father.
Yes. Konkani group is there. You can send a hi to who is there in Konkani group? Admins?
I am there, Father, in that group.
Okay.
Kankuni or Kannada, I'm not sure, Father. I'll see one. Oh, no, Father, I'm not there in the group. It was exited. I'm not there.
That means we'll add the concerned admins will add or send, she can't send hi because she doesn't know who is in charge. Yes. Any other question at the YouTube comment space? Yeah, today's session was well explained. Thank you, ma'am. Anju. Yes. Congratulations, Anju, ma'am, and thank you for this wonderful session. Purpose, expanded body paragraph conclusion. Bobby Babuji, yes.
We are going to discuss that questions, right? Total knee
Which one?
replacement.
Which one?
8 to 1.
Sorry.
From knee replacement, is it?
And total knee
Yeah.
replacement from the question
What did I take up in the previous session? What was the topic?
total knee replacement.
Okay, A and D we did, right? And you will be doing B and C.
No further, they will
I'm
go
s-
from the questions.
They are going
Yeah,
for
yeah,
just
yeah.
1 to
But
20.
no, task was given B and C, right? I'll have to explain it
Yeah.
again next session. Yeah.
Yes, Father.
Okay. Yeah. Those things admins can remind me because otherwise I'll have to search and find out. I may go into something else. And I will be doing 20 questions. That is cool. But then task was given B and C, which I need to explain again. But people haven't asked any doubts regarding that. I think it's cool for them. Total knee replacement, I'll remind me to send the videos, okay? We'll send the videos. I think Arya ma'am has taken a session on that. I'll post the videos.
Yes, Father. Arya ma'am mistaken.
Yeah. So that when you watch the video, like Tomili, or not Tomili, somebody else was telling, Tomili, right? You are doing knee replacement till 3 o'clock, we said, right? Yeah, we'll send you the video, check out with that as well.
Yes.
So that you get a clarity. See, if you watch the video in the beginning, that will not help much. When you have struggled with the material, then you don't understand something. When you watch the video or attend the session, you understand far better. Because you didn't understand particular question or you did not get the answer or you have a confusion. That's why we follow this method. So send all your doubts, or if you have any difficulty with any strategies or anything from that knee replacement B and C or A, B, C, D, no. Yeah. That is cool, I think. Nothing else. Venisha not smiling. Dr. Arshia is very serious. Yes. Okay. Right. So, shall we close with a smile? Yes. And see that when I post this one, if we can put in the status and all that, so that we reach out to them. Now we are starting a part proper, no? So if the people join from the beginning, it will be easier for them. In the long run, it will be quite challenging for them to follow up. And next 3 months, anyhow, we can start a new batch again. At YouTube, bye everybody. Okay. Great. God bless you all.